I guess we could probably go ahead and get started. What do you think, team? Wait a few minutes or go on and get started?
We can go ahead and get started.
All right. Well, good afternoon, everyone. Today's meeting is one of Dr. Mack's educational offerings. Oh, I'm sorry, Andrea. Let me back up. Go ahead, Andrea.
Hi, everybody, on this nice, warm July 8th. I'm the chair of the board of Dr. Mack, and welcome to this educational offering. Take it away, gang.
All right. Thank you, Andrea. Apologies for that. As I was saying, we want to say good afternoon to everyone. And today our meeting will be our educational offerings, and we will be learning how to support people with disabilities and veterans. We are so excited to share these resources with you and hope you learn something alongside us. As usual, Steph will begin the meeting by reminding us of all of our mission and addressing some Zoom housekeeping.
Thanks, Colleen. For those of you who are new to our meetings, welcome. We want to share our mission at the beginning of each meeting to remind ourselves the lens in which we look through. Dr. Mack's mission takes a multi-level approach to inform and empower people to overcome mobility barriers through education, collaboration, and advocacy to enhance the quality of life. And in each of our meetings, we focus on a different aspect, and today's is all about education and advocacy. So if you haven't done so already, please go ahead and type your name and organization into the chat. If you've been in one of our meetings before, you already know the deal, but we kindly ask that everyone stay muted unless you're speaking. Feel free to use the chat as needed for questions or share comments. And you can also use the raise your hand function to, if you have something to add throughout the meeting as well. So with that covered, let's go ahead and move on to some brief staff introductions and updates from the Dr. Mack team. So I'll go ahead and get us started with that. So I'm Stephanie. I'm the program manager here at Dr. Mack. I oversee all of our programs. And I want to, as always, plug our travel training program. We are ramping up as we start booking for the fall. So if you're interested in scheduling any travel training sessions, again, they're free. At the end of our in-person sessions, we offer a field trip where we take folks down to Union Station so they get to practice what they've learned in the classroom. Our trainings are available in English and Spanish and other languages as well with the assistance of interpretation. So please reach out to us if you are interested in getting one of those set up. Latoya.
Thanks, Steph. I'm Latoya Pranti. I'm the development manager here at Dr. Mack, oversee volunteers, interns, and some great news. I'm excited that we officially have an intern that'll be with us fall, spring from MSU for her master's program, she, her, hers. So down the road, we will be introducing her in one of our meetings. Malia?
Hi, everyone. I'm Malia. I'm the administrative project coordinator at Dr. Mack. And a little update on what I've been up to lately is just a lot of research and finding new funding opportunities. We're trying to get creative in how we move forward with our funding. So I've been digging into that. Maria, I don't believe is with us yet. We'll go to Arthur.
Hi, everyone. I am the Outreach and Development Coordinator here at Dr. Mack. The main thing I want to talk about is all the events we've been able to go to. We went to 6 events in June that had different focuses on different populations, including the LGBTQ, people with disabilities, unhoused folks, the biking community, and other alternate travel communities, and family communities. So that's been really cool. And then in July and August, we're going to a bunch of events. We're focusing a little bit more on families as back to school stuff starts kicking in. So students and families is going to be our focus, and we're excited to be out in the community again. And we'll go to Latoya.
Thanks, Arthur. And thank you, Dr. Mack team. So we could just get started. Our first speaker for today is Christy Britt with Cultivate VetGo. Cultivate VetGo program connects seniors, veterans 60 plus, and their family members who are 60 plus with reliable transportation to and from their medical appointments. So Christy, the floor is yours.
Excellent. Thank you so much. Glad to be here. So Cultivate is a nonprofit that serves seniors 60 plus in the Boulder, Broomfield, and Weld County areas. We have multiple direct service programs for the older adult population, but for this meeting specifically, we have our VetsGo program. And what that is, it's a volunteer provided transportation service, medical transportation service for senior veterans and their senior family members. This particular service is offered in Boulder County, Broomfield County, and the southern parts of Weld County that are right next to Boulder County. It doesn't go much farther north than that, just due to the constraints of our volunteer availability. And really, that is the only criteria. Live in the area, be 60 or over, and either be a veteran or the direct family member, spouse, or widow of a veteran. And what makes this program really great and unique is that we offer door-through-door service. Our volunteers provide their own vehicles, so we unfortunately at this time do not have wheelchair transportation, but our volunteers are able to help those who do have mobility devices, or they're able to at least get in and out of the car on their own. And so our volunteers will offer that, an arm if they need some help with stability. They'll come get our client at the door, get them into the car, get them to their medical appointment. A lot of times our volunteers are staying with the client at their medical appointment just until it's done. They're not able to act as any sort of proxy or medical, if the client has questions about the medical terms or anything like that. Our volunteers don't do that. They don't go into the appointment, but then they'll take our client back to their home. We go anywhere as long as the ride originates in Boulder or Broomfield County. We are taking a lot of our vets to the VA hospital in Aurora, Colorado Springs, even Cheyenne. So as you can imagine, those rides could get very costly if you're trying to pay for it privately, or even trying to coordinate public transportation can be a nightmare. So our services are at no cost to the client at all. And really, that's what we do. Over 60% of our clients do have a disability or a mobility device. So we are really focusing on populations that need that help with transportation and need a trusted driver to get them to and from their appointments. Any questions? Super quick.
That was quick. Any questions for Chris? Thank you, Christy. Appreciate it. Any questions for Christine? Okay, well, if you have any, you can always put them in the chat, and I'm going to pass it on to Steph.
All right. So our next speaker is Rachel Walker from Developmental Pathways. Rachel is the Senior Manager of Community Affairs at Developmental Pathways, and she's been with them for over 16 years, starting in 2008. Throughout her career at Developmental Pathways, she spent time in both the early intervention and community engagement department. And Rachel has been in Colorado her whole life and enjoys spending time with her husband, Ryan, her son, Zane, and dog Pixel. So Rachel, the floor is yours.
Thank you so much. I appreciate that. Hopefully I see a lot of familiar faces on this call. So hopefully many of you are familiar with Developmental Pathways, what we do, how we partner. I'll have you actually flip to the next slide here. This will be how we spend our short time together today. I promise to be quick. I think we can get really weedy very quickly when we're talking about disability services. So this is just a general overview, but we'll start with introductions, a little bit about Developmental Pathways. I know this is a broader audience today, so I plan to share a little bit more about what the disability system looks like in Colorado, knowing that our area is pretty nuanced and that I saw Adams County, I know there's Denver, we just heard from Broomfield and maybe up north in the metro area, so I want to make sure that we hit on that. I'll touch on the programs, specifically the programs that are available statewide, and then some specific information about referrals and intake that will be specific to Developmental Pathways, but certainly we can take referrals from anywhere. I'm a very informal presenter, so as we go, if you want to just let me know if you have questions, feel free to unmute, wave a hand. If we were in person, I tell you to throw a shoe at me. However you want to get my attention, feel free. But we'll also have space at the end for questions as well. Next slide, please. And one more. So thank you, Stephanie, for that introduction. I really appreciate it. Yes, I'm coming up on my 17th year at Developmental Pathways this September, which is wild to me, but I've been in the disability field for almost 20. Like was said earlier, I'm part of the community engagement department. We do a lot of the public facing work for the agency. So that's in my wheelhouse. I do a lot of presentations, public speaking, networking, and all of that jazz. But to make it a little bit more personal, we always try to include that little tidbit. Of course, my family is like #1 for me. But beyond that would be a good thrift sale and any podcasts that have no meaning whatsoever and just kind of rot the brain. I will spend hours on those. So if you guys have any good recommendations, please post them in the chat. Next slide, please. And we'll go one more. So a little bit about Developmental Pathways. We have been serving our disability community for now 61 years. But many of you know, and we'll talk about this in a little bit, that we went through some major redesign in November 2023, where we kind of grew and we absorbed additional programs and services. So this is a snapshot of what we look like today. We have about 600 staff. We serve the lifetime or the lifespan for people with disabilities, so from birth to death, which is that nice little track at the bottom. And our designated service area is Arapahoe, Douglas, and Elbert counties, which translates to about 15,000 members that we're serving. Next slide, please. This is how Developmental Pathways helps. Just like you would assume, as a case management agency, we provide case management services. So every program at Developmental Pathways has a case manager or like position. There's no cost to our programs or services. So we have local, state, and federal level contracts that we use to fund services. We're part of long-term supports and services. So it's really nice for especially this group to start thinking of if you have someone who might have a disability that needs long-term supports and services. It's not, we broke our leg, we kind of need immediate care, but we're going to be on our feet in just a little bit. No, these are the folks that will have kind of that more significant functional impairment. And then many of you know, because I see lots of familiar faces, that we partner like crazy with all sorts of other amazing community resources and partners. So that's some of the work that I do. I'm joined by my colleague, Allie, and she also is doing that work. So we really know that we can only be successful if we lean on each other. We really maximize our shared resources. And I really value at least all the partnerships in this room. And if I don't know you and you're intrigued by this presentation, please reach out to me. I drop my email and contact information in the chat, and love to learn a little bit more about what you do and maybe places that we can partner a little bit more. Next slide, please. So this will be the slide that I always ask people to pay attention to. So if you forget everything else that I told you, except for maybe podcasts, but everything else that I've told you, please just make note of this slide. This is who Developmental Pathways serves. These are also the pockets of populations that your case management agencies, which we'll talk about the disability system in a second. These are all the people that those case management agencies, community center boards, and EI brokers serve. So it's really important for you to know our base and not necessarily the programs, because those programs shift. Some people are eligible for multiple programs. We just went through another major redesign. So some of the programs got combined. So it's not entirely important that you know the programs, but it's more important that you know who's eligible. So I told you we serve the lifespan, and how that translates is into these general buckets. These are broad strokes, so there's definitely some exceptions to this specific definition, but for your education, this is who we serve. So Developmental Pathways has always served our intellectual and developmental disability population, or IDD for short. That's who we've served for the last 60 years and will continue to serve. That includes IDD adults and children. And then I do like to call out children under the age of 5 can qualify based on developmental delay, not by disability. So just a little note for our youngest members. I like this illustration too, because it shows you our growth that happened in November 2023. We added the other 4 boxes in November 2023. So we historically have always served our little orange circle, and then we added the additional 4. So now we serve children under 18 with medical needs, adults maybe 18 and up, there's a little nuance there, with disabilities, blind, physical, HIV, and AIDS, adults 18 and up with mental health needs, and adults with brain or spinal cord injuries. So those are kind of our main pockets that we serve. That middle section that's more teal is kind of a general category. So if you know someone with a significant functional impairment due to disability, they could probably fall into that category. Next slide, please. And we'll keep going. There we go. So I like this. I know it has a lot of text on screen and I won't go through every box, but I believe I provided the slide deck and I said we could share it out with this group today. So there's some links there if you want to explore a little bit more. But there are 3 general contracts in the state of Colorado for disability services. The first is for our littles, right? Our early intervention broker contract. So that's our program 0 to 3 years old. I'm going to skip along there because I think this group is not necessarily working with that population all the time. The next would be our long-term care, or what's called a case management agency. That includes our Medicaid waivers, a couple non-HCBS programs that are called that. There's some state programs wrapped into that. It really says, hey, these are the services that people with significant functional impairment and disabilities would fall into that catchment area. The last is called a community center board, and that's CCB designation. So this is specifically to our folks that have IDD. And this would sometimes be looped back through, and this designation is important because it loops back through our local contracts for mill levy dollars. So those are the big buckets of programming that are available. Developmental Pathways holds all those contracts. So we're one of those agencies that is the EI broker, is the case management agency, and is the CCB for our Arapahoe, Douglas, and Elbert counties. But there's additional resources in other areas, and it kind of just depends which area you're in, which agency you might be served by. So I included a couple links for you guys. So if you want to research, if you're from a different area, that you can just click on that and find the program or service case management agency that you would be working with. Next slide, please. So this is the illustration of what happened November 2023. I know that feels like a while ago. It feels like yesterday to us because it took a long time to recover from this transition. And that might sound like a broken record because a lot of you have heard about the transition already, but I really like how this is laid out for us. So previously there would be a couple different agencies per service delivery area that would be providing case management services for long-term supports and services. It got very confusing. So statewide, I think there are 40 to 45 agencies out there. So some people would be like, hey, I'm going to go to Developmental Pathways, but DP only offers 4 of those waivers. I'm going to go to a very specific private case management agency. They only offer 1. I'm going to go to this other case management agency. They might offer 6. I might be eligible for services under all 3, and I have no idea where to go. And so that was the experience of a lot of members. It got very confusing. They were turned around and they weren't able to maximize their services that way. What Case Management redesigned, it took all those different case management types of offerings and housed them into one entity per service area. So really smart redesign on the state's part to streamline the process. It streamlines their oversight, it streamlines the experience for members, and it allows us to better serve as a case management agency what our members need. But it took a while to get through that transition. So if you guys experienced some disruptions during that time, I wouldn't be surprised. But hopefully the ship is righting itself because we just experienced another wave of changes last week. All right, so next slide, please. We have a lot of metro area folks on this call, so I thought this would be an important slide for you. So these are your case management agencies per your county. This is available on our website, so you're welcome to go to our website if you want to print this off for your own education. But I also included the full case management agency directory from the state in the corner for you. All right, next slide, please.
Rachel, may
Yes.
I ask a quick question?
Please, Andrea.
Where do the ARCs fit in? The ARC of Arapahoe and Elbert, those organizations.
Great question. And I think I saw the ARC of VetsGo on here. So feel free to chime in, whoever that was, but happy to answer. So the ARCs are a separate entity. They're a more private entity, and they provide advocacy and education. Brent, is that you from the ARC of VetsGo?
Yeah.
Yeah, they partner with the case management agencies, but they don't hold those state, federal, and local contracts. They're really a separate entity that provides advocacy and support for those members in our services. They typically work with our IDD population, that intellectual and developmental disability population, but their definition is broader than what a CMA might be doing. So, Brent, I'll let you go from there. I thought sums up so that I was on the right track.
Yes, I'm the consulting advocate at the Jefferson, and Gilpin counties, and all CMAs, Jefferson County Human Services, right? Hey, Joe?
Yep. Yep. So, and we for developmental pathways, we work with the ARC of Arapahoe Douglas and Elbert and the ARC of Aurora. We have 2 ARCs that we work with. So, Andrea, how this might play out in real life is developmental pathways, we're providing those services to someone, and perhaps the member in services doesn't feel like their voice is being heard or needs a level of advocacy, or frankly needs someone to just help explain a very complicated system. They would call their ARC to say, we need more handholding, we need more support, we need more facilitation. And the ARC would provide that as their like advocate coming in and working with the CMA to say, hey, we reviewed the plan. We think this member might need X, Y, Z changes to their plan. And we know their rights, we know the system, and then we know what they're entitled to, and to make that happen. They also do this within school districts quite a bit. So they'll attend, our children who are in special education, their IEP meetings to say, school district, here's what we know. Here's what this family's rights are. I'm speaking on behalf of this family to provide them the services they need. So, Brent, did I capture that correctly?
You're all on the right track.
Okay, good. Love
Good
the
job.
question. Yeah, thank you. Anything to add, Brent?
No,
Okay.
not right now.
Okay, feel free to chime in.
Andrea, did I answer your question?
Yes, I think so. Thank you both.
Okay.
Thanks for asking, Andrea. This is meant to overwhelm you, this slide. It is all the entities of accountability at the state and federal level and even local level. So when you win these contracts, it sounds so lovely, right? To say, hey, we're able to offer these additional services, but what gets tied to offering those additional services, which should be of no surprise to anyone in the room, is a lot of paperwork and reporting and quality assurance. So I don't need to track this for you. It's more for illustrative purposes only to say it's a complicated system. There's a lot of entities involved. We have to fill out paperwork for almost every one of them. And so when it feels difficult to get enrolled into services, some of the reason is this system map. On the bottom here is where we track into, right? It talks about the CMA, the EI broker, and the CCB. So we're at the bottom here. We're the operators of the program, but we have to report to all of these folks. Next slide, please. Oh, the 3 changes that are happening. And I do feel like this is worth calling out because they happened July 1st. And so if you guys got adjusted to what was in the system, it's changed again. So it's really good to call out because we have a lot of shared members, right? There are people that you are serving, that we're serving, and it's good for you to have a general understanding of what might be happening at the system level. All of these changes were made by the state to increase access to services. So huge win philosophically. I haven't checked in with our case management teams to see how operationally it's looking, but that could be another story. But in terms of actually what was thought, the intention behind these changes, a huge win. So the first is what's called the wellness education benefit. This is essentially either a paper or digital newsletter, and it includes great information for our members to have ongoing. And I believe it's monthly. So they want to sign up for that. It's an easy benefit to get through your waiver services. If you are a little savvy to the system, I'll say, your members want to accept this because some of the waiver services got pulled off the waiver, which we'll talk about in a second. And this might be the only way that they stay eligible for Medicaid and the waiver. So if they understand the system, and I can explain that a little more fully when we get to CFC, but just know that if they get offered this service, I'm looking at someone like Chanda and Melissa to make sure that you guys, I'm sure you're aware, but if they get offered this service and they were only getting attendant-based services on their waiver services, they need to accept this because that might be the only way that they're eligible for Medicaid ongoing. 2 of the children's waivers got combined. I know this is not a focus really for this group, but it's worth mentioning that that CLLI, children with life-limiting illness waivers, and then children's HCBS, home and community-based services waivers got combined into children with complex health needs. Also, when no one lost services, in fact, if you were on CHCBS, you got additional services that were available under CLLI that you weren't historically able to access. Those are specifically targeted to our children with really high medical needs. And then where we'll kind of spend a second more is about community first choice, which was the big change that happened a week ago. This is a huge win. It means that more people have access to what we call attendant-based supports. Yes, yay, I'm really excited about it, but it also means that people have to be kind of strategic on how they navigate the system, which I already showed you the system is very complicated, so there is more strategy here. Next slide, please. This is community first choice in a nutshell. So I'll explain this as quickly and as easily as possible, but know that this has been diluted down from a very complicated explanation. So in the state of Colorado, generally speaking, Medicaid services are kind of organized in this pyramid shape. The bottom part is for everyone who qualifies for Medicaid, whether it be for disability or based on income. Everyone gets the state plan. If you start needing additional services based on disability or functional eligibility, you track up in the pyramid. At the tippy top is where your case management agencies exist. We're the ones that operate those HCBS waivers. Those HCBS waivers get an added set of benefits for our folks that have the highest disabilities in our services. So for this group, it might be non-medical transportation, it might be respite care, it might be community connector. There's a lot of amazing waiver services. It's home and vehicle modifications, a lot of amazing services that are under HCBS. What Community First Choice did was they took what they deemed attendant-based services, pulled them from the waivers, and pushed them right above the state plan. This means that members who are eligible for the state plan, who meet functional eligibility, meaning they have to have a disruption in their activities of daily living significant enough to meet our functional eligibility, but now can access their attendant-based services. And that's huge. So someone could come in and support with personal care. Someone could support with homemaker, which is house cleaning. We have remote supports. The whole list is there. Home delivered meals, the PERS system, medication reminders. So all of these services are now more broadly available to that bottom purple bar of state general plan. Huge, huge win. The reason why this has a little strategy is if you qualify for anything on the pyramid, you qualify for everything underneath. So if you qualify for HCBS, you now qualify still for CFC. So anyone that's existing on a waiver should not, I will say operationally, we'll have to see what it looks like, but should not have a disruption in their services because they continue being eligible for CFC. There's a little bit of a catch, and this is what I was trying to explain earlier. This is the savviness that you have to know in the system. So if you were a member on an HCBS waiver and you were only getting attendant-based services, you were only getting personal care, you were only getting homemaker services, now all your services are pushed to this new program called CFC. And you're like, great, that's awesome. I'm just going to work with CFC. That's not always the case. The reason why waivers are important is because it allows you additional eligibility for Medicaid. So you don't have to meet the same financial criteria for state general plan Medicaid. It waives some of that criteria. So if you were only eligible for Medicaid because of your waiver status, because you met functional eligibility, because you got waived on that financial piece, you could lose Medicaid entirely if you don't accept that web benefit. And so I want to call that out here for the group because that web benefit seems like a small component, but because you have to receive one service a month via Medicaid HCBS waiver in order to maintain your Medicaid status, that web benefit might be your one service a month, and that would give you access to Medicaid ongoing. So hopefully that's tracking for you. I realize I'm explaining a very complicated concept. as simply as possible. So I'm going to pause for a second to see if anyone has questions or if that tracks with someone.
I have a question, Rachel.
Hi,
So
Melissa.
just to be clear, so if you qualify for HCBS waiver, you are also automatically enrolled into CFC, so you can be a part of 2 programs at once?
Yeah, but you'll have one case manager that's supporting both, is my understanding
Okay.
at Developmental Pathways. Yeah. And if you're currently on an HCBS waiver, you might not even feel the disruption.
Perfect. Thank you.
Great question. All right. Next slide, I'll breeze through these because I know we're tight on time. Programs, we've talked a little bit about it. So I told you who's eligible for our services, and then they kind of get pushed into these general buckets of programming. So we talked about EI. Our local programming is specific to our folks with IDD. We also have state level programming, and then we spent a whole heck of a lot of time talking about those HCBS waivers. And I've kind of skipped over some of the nuances with HCBS waivers. So if you have questions about that, just reach out to me and I'll explain. And there's an and more. There's always additional services. I think we're tracking above 25 different programs available at DP. So again, simplified, and they rotate and change, and don't worry about the names or the specific programs and services. We'll figure that out for the people that you refer to us. Next slide, please. One more slide. So this is the pyramid again. So I already explained a little bit about how the pyramid works, but this is the simplified version that doesn't include HCB or CFC on it. And I like this illustration because it is that pyramid. So if you qualify for HCBS, you get long-term supports and services, which kind of would look like nursing level facility supports, and then state general plan Medicaid. I did fail to tell you in the earlier slide that you can really be eligible for Medicaid one of 2 ways in Colorado, via income or via disability. So we're talking about the disability track today, but that's not to diminish the way that you can be eligible via income. Next slide, please. These are all the waivers as they stand today. So I told you the redesign. There were 10 at June 30th, and there are 9 as of July 1st. And that's because the 2 children's waivers were combined. Again, you don't need to memorize this list. Just know that all those people that we talked about who are eligible for services generally get tracked into one of these programs. Next slide. And then to just pique your interest about what might be available in adult services and adult HCBS day programs, pre-vocational. So if someone's interested in employment but isn't ready for employment, that might fall under pre-vocational. Supported employment, meaning, hey, we want to seek employment, but we need someone to help me with me and on the job site, and then help with working with my employer. And then independent life skills training. So additional services available through the waivers. This is a very short list. Every waiver has a super comprehensive menu of services that are available underneath it. Next slide, please. These are the additional non-HCBS programs. A lot of these are more targeted to our senior population, so I'll point that out. For example, PACE, that Programs of All-Inclusive Care for the Elderly, gives people a medical home. And so as well as recreation activities, there's all meals, everything. So they can kind of go to this facility, get all of their needs met, including a lot of social engagement and that sort of thing. And then that can kind of be their home base for a lot of their additional services, but it's meant for those senior and aging population. Next slide, please. So this is the intake and enrollment process. Again, just to illustrate to you that I showed you the system map. This is how it gets operationalized. This is all the steps that someone has to go through and to enroll in long-term supports and services. I will not go into all of them with you, so you can take a sigh of relief, but just know it's very complicated. It's very complicated, and I set up this slide just to manage expectations. So when you refer to someone to our program, we don't want to make it difficult for them, but we have to go through all of these steps. And so we want to make sure that anyone that you're referring to us has a good, realistic understanding of what it might look like, that it's not going to be tomorrow that they enroll into services. It's going to take likely several months to enroll into services. Next slide, please. And this is how to refer to us. So I included some links here. There's no wrong door in the state of Colorado, so you can knock on any case management agency's door, or any CCB or any EI broker. And if we're not your designated service area case management agency, we'll find who is and refer you there. So even if you're not in our area, you are welcome to still refer to us, and we'll get them tracked in the right space. And that should be it, I think. Yes. So you guys asked some great questions already, but please feel free to ask me more questions.
Other questions for Rachel? Oh. Was someone just about to say something? Or maybe
I don't think so, Stephanie. I
Okay.
saw your mouth moving and then it took your audio a second to catch up. So I was like, oh shoot, but
Okay,
you're good.
I cut myself off then. Okay, well, thank you so much, Rachel, for sharing all that information. And if anyone has any other questions they think of later on, please feel free to put them in the chat, send them to us, and we can pass them along. But thank you so much for sharing. All right, so we are going to go ahead and move on. We do have some resources. These are shared from Yadwiga Brown, who's not able to make it today, but she wanted to share some blind and low vision service program information. And this provides training to people who are seeking employment in the following areas: orientation and mobility, daily living skills, low vision, and assistive technology. All visually impaired individuals who would like to attend guide dog training have to complete orientation and mobility training. There are some guide dog schools that provide an accelerated O&M training program at their facilities. It does require a person to get there for about a 10-day program. And there is also a state program for older adults who are blind. The program works with seniors who are visually impaired but not interested in employment. So yeah, we'd just like to thank Yadwiga, who is a certified orientation and mobility specialist and vision rehabilitation therapist with blind and low vision services, for sharing this information with us. All of the services, or all service provided and information about the program, will be sent to you after in our post meeting email that we've been sending out, so you can watch out for that there. So yeah, just wanted to share that all with you today. And next, I'm just going to, I kind of already plugged it, but just kind of want to remind everyone about the travel training opportunities that we have. We also have technology training, if anyone's interested in that. So yeah, I won't bore you with saying the same thing again, but just yeah, keep our travel training in mind. And if you know any organizations that would be interested, or any groups, libraries, things like that, please let us know. So yeah. And then this month, we just want to give a quick 2 to 3 minute spotlight for our members. So of course, you all heard from Rachel at Developmental Pathways already, the wonderful information we shared. But Rachel, we just want to see if you have any events or anything coming up that you want to share, any news or updates that you didn't get a chance to talk about.
Oh gosh, we have a whole lot of updates, so you can check those out. Mostly on social would be the best place to find them. But this is July's Disability Pride Month, and so we're partnering with Arapahoe and Douglas County Fairs to do really adaptive rodeo experiences for our folks with disabilities. They're more targeted to children, but we've opened it up to day programs in our schools as well. So you can check out social there. We will have 2 upcoming voter engagement events this fall. So voter engagement with people with disabilities is a really primary focus. We want to make sure that anyone who has a disability knows they have the right to vote, and to make sure that it's accessible. We'll have ways to register for voting. We have the last couple of years tied up our voter engagement events within a bingo format. So we do ballot bingo. It's a whole heck of a lot of fun. They're free events. You can find out more. That information will launch soon. Again, social media would be a great way to follow us. And then I would be remiss if I didn't mention one of our greatest needs, and I think, Andrea, you've participated in this in the past, where we do a holiday outreach. So we adopt, gosh, almost 700 individuals out of our service area. They're nominated by their case managers and service coordinators. They cannot self-nominate. We ask that the people who know their caseloads nominate their most in need families who would not be able to have gifts this holiday season if it weren't for this program, and then we connect them with sponsors in the community. Developmental Pathways takes $0. We lose money on this because we provide the staff and everything. So it's a very unique program versus maybe some other programs that have the overhead or anything like that. Developmental Pathways is going to eat that. So your donation to Pathways Holiday Outreach goes directly to the family, and then we match you too. So if you say, hey, I really want to adopt an adult in services that has no additional supports, maybe their family's gone, maybe their family's given up on them and is no longer in the picture, we can match you with an adult, and you'll get a little dossier about that individual that you adopted. You have the choice to purchase, thanks, Sally. You have the option to purchase gifts directly for them. You can send us gift cards. We will purchase for them, or we will forward them their gift cards. We will make it work. If you want to purchase gifts and drop them off, we'll have a drop-off day, and then our people can come and grab their gifts. We have a lot of options for it. However you want to engage with us, however you want to support holiday outreach, we would welcome that. It seems so early because it's July, but you know, Christmas in July and all of that jazz. We start our sponsorship campaigning next month. So it takes us that long to find sponsors for our 700 individuals. So Allie dropped her information in the chat and leads this program every year for us. So if you are inclined to support it, and it's something I said to you piqued your interest, please just reach out to Allie. We're also really looking for corporate level sponsors. So if you know a corporation who has maybe end of year giving programs that are like, hey, we really need to find an awesome way to spend this money directly to people who need it and need that tax write-off, we're your program. So just reach out to us and help us make those introductions. And that's it. We have a bunch more stuff going on, but those are the main ones.
Yeah, thank you. I do love a good game of bingo, so that's fun that y'all incorporated that. Awesome. Yeah, thank you for sharing that. All right, I'm going to pass it off to Arthur, who is going to talk to us about our members and membership.
Yeah. In addition to our member spotlight, thanks again, Rachel. We always want to give a big shout out to all our amazing Dr. Mac members. If you're not a member yet, there's still time to join and unlock some fantastic perks. Right now, membership prices are 50% off for the remaining year ahead of our head over to our website to learn more. So thank you very much, and we'll pass it on to Colleen.
Thanks, Arthur. Really quickly, I want to talk about the RTD proposed August changes. And RTD is proposing service changes that will take effect August 31st, 2025. The changes are designed to increase reliability, connectivity, improve on-time performance, account for seasonal ridership trends, and account for RTD's continued work on the downtown rail reconstruction project. The proposed changes also support the agency's system optimization plan, which aims to enhance overall transit experience for customers. And if you need more info, you can find more information on their website, or you can ask one of us and we'll try to, thank you, Steph. We'll try to answer to the best of our ability. And that we have a little bit of time left, so we'd like to open the floor to all of you for any updates, any events you have going on, or anything you'd like to promote, or just something you think the rest of the group should know. The floor is yours. You can either unmute, raise your hands, or just type it in the chat. Anything going? No?
I'll take a
Trying to think.
minute. And since Marie is not here, I'll speak on her behalf because she didn't give an update. But I know she's really pushing for people to hand out our INA, our information and assistance phone line. Anybody that's in need of a ride, send them our way. I'm doing the presentation, so maybe one of the staff could put in our phone number in the chat. But yeah, we'd love to talk to them. We'd love to work through any of their transportation issues with them. So please send them our way.
Oh, that's a good reminder, Malia. And I also want to remind everyone that, did you say that we have text capability now?
I hadn't, because I wasn't quite
That's
sure
okay.
if we were ready for that.
Yeah, we can provide service via text. I think you did mention the chat function, and we also have we can interpret in different languages. So thank you I know Maria did want to talk about that, so thank you, Malia. Brent?
Yes, we have our annual picnic on July 23rd, 4 to 7 at Clement Park in Southwest Jeffco, and I will send you and Latoya the information.
Thank you. Is that open to the public when anyone can
Yes,
come?
4
Okay,
to
thank you.
7.
Thank you. That sounds like fun.
Oh,
Um,
excuse me. I'm sorry. I choked on my.
well, hello, Miss Tracy.
Hi. I wanted to know if you guys could send me, oh, what are the guys called? Because you know I have many, but I need more in if you have it in the Korean language. Do you know if you
Okay,
have those?
so we did not print, we only printed copies in the English and Spanish languages
Okay.
because there wasn't that much of a need, but you can go to the website and the Getting There guide is accessible in all the other languages. You just have to
Okay.
download and print it. But if
Okay,
you
because I'm
find
getting.
that I'm sorry, go ahead, Tracy.
No, I was just saying we're getting a lot of new residents here, and you know we work with the 62 and over community, but like
Right.
our last 4 or 5 residents that just moved in, they're all Korean.
So, and that's Volunteers of America,
Mm-hmm.
right, Trace? So the good thing is we are getting ready to print the 17th edition team soon here. So if you're finding the need that you have, we just want to make sure the cost fits the need. So if you're finding that you're getting a lot of residents in that need it in that language, we could print a few copies for you
Yeah, I don't
in
even think
Korean.
I would need a lot, maybe 10
Okay,
at the most.
okay.
So,
In the
That's what's
meantime,
up.
too, Tracy, the app, the Getting There app, at the top of the screen, there's a little drop-down menu to change the language, and it translates all of the provider information into. It uses Google Translate, so you might want to take the
of course.
translation with a default sometimes, but that might be a quick, easy, like interim solution for that as well.
Okay, thank you, Stephanie.
Anyone else? Okay, I feel like I always rush it and then someone has something as soon as I move on. But I'm gonna just assume there's nothing else and move on here. Okay. So that brings us to the end of our meeting today. Okay, let's give you guys back a gift of time. Thank you all for attending and learning with us. We look forward to seeing you at next month's member meeting scheduled for August 9th from 1:30 to 3 p.m. on Zoom. All are welcome to join our member meeting, even if you aren't currently a Dr. Mac member. The registration links for the rest of the 2025 meetings can be found on our website. And thanks again, and we hope to see you all next month. Bye, everyone. Enjoy the rest.